If you've got pain in your neck that just won't go away, no matter how many massages you have or anti-inflammatories and prescription painkillers you take, no matter how fancy or ergonomic your work chair is, or how many sessions of physical therapy you have, you might have a problem with the shape of your neck. In this video, I'm going to show you 5 quick and easy ways that don't require an x-ray to figure out if your neck is normal or potentially problematic. First thing to understand here is that when we're talking about the neck, there is such a thing as a normal shape. A normally shaped neck, when viewed from the side, has a gentle C-shaped curve in it that usually ranges between 20 and 40 degrees. That's about as much curve as you would see in a banana. And why is that little curve so important? Well, there are several reasons. First and foremost, it helps to support the weight of the head with a minimum of muscular effort. In other words, it makes us really efficient at being in this tall, upright posture. Second, it helps to line up all of the little individual joints in the neck and the spinal discs for maximum mobility and functionality. So being in this position sets us up to move through the greatest range of motion and makes it possible for us to withstand the impact forces associated with activities of daily living. And a loss of that normal curve in the neck has been associated with a bunch of different problems, with everything ranging from chronic muscle strain to soft tissue pain syndromes, to increased frequency, intensity, and duration of headaches, to early onset arthritis and degeneration, and increased incidence of things like disc herniations, nerve compression, carpal tunnel syndrome, thoracic outlet syndrome, and rotator cuff tears. So with all that said, let me show you how to quickly figure out if you've got enough curve in your neck. One of the fastest ways to gather information about the shape and alignment of your neck is to see how your neck moves. Imagine that you were building a wheel out of wood or stone. What would be the quickest way to figure out whether or not that wheel had the proper shape? To see how it rolls, right? Because structure dictates function. And the same goes for your neck. And what we're looking at here specifically is the range of motion. You see, when the normal neck curve is present, it means that all of the little individual joints in the neck are aligned, which allow those joints to move through their full range of motion. The other thing that happens when the normal curve is present is that the head is held up with a minimum of muscular effort. But when you start losing that curve and the head starts shifting forward out of its normal alignment, the little individual joints in the neck become decentrated, meaning you don't have optimal contact between the joint surface above and the joint surface below, which can restrict range of motion. The other thing that happens is that the perceived weight of your head progressively increases the further your head shifts out in front of your center of gravity, which means that the muscles that attach to the head have to tighten up and work harder to hold that heavier head up. And that too can restrict your range of motion. And there is an established norm for range of motion in the neck. And what it looks like is this. You should have 40 to 45 degrees of left lateral flexion. You should have 40 to 45 degrees of right lateral flexion. You should have 80 to 90 degrees of left rotation and 80 to 90 degrees of right rotation. You should have 60 degrees of extension and 50 degrees of flexion. All the side-to-side motion should be symmetrical, and all of the motion should be completely and 100% pain-free. The second thing to look out for that gives a strong indication of a structural problem in the cervical spine is a thickening, hyperdevelopment, and filling in of the upper trapezius muscles here at the base of the neck. What you'll spot initially is that something seems out of place. The muscles there at the base of the neck will be bulky and developed in a way that is way out of proportion to other muscles in that person's upper body. In other words, they're going to have the neck of a weightlifter despite the fact that none of the other muscles in their body look like they've ever lifted a weight. This is particularly easy to see in a person who is smaller framed or petite. The reason that this happens is because the further the head pushes out in front of the body, the heavier it becomes and the more demand is placed on those muscles that are responsible for holding the head up. Over time, just like putting demand on muscles lifting weights, the muscles grow bigger to deal with that demand. But unlike lifting weights, which you do for maybe a few hours a week and then you rest those muscles the rest of the time, those muscles are under constant tension. And so if you go up to people who have those hyperdeveloped traps and you even lightly push on them, they will wince and pull away and usually be in pain just from light pressure. And the change of shape that I'm referring to is that a normal trapezius should have the shape, when looked at from the side, of Half Dome in Yosemite, where there is a flat-faced front and then a dome-shaped structure on the back. But when a person has those thick, hyperdeveloped traps from being in forward head position, it will be a fully formed dome that is round on the front and the back. Here's a patient that came into my clinic with exactly this structural problem. In 2010, this study was published in the journal World Neurosurgery, and these researchers did a photographic analysis of the upper trapezius muscles in a bunch of people who were going to be having neck surgery. And they compared these photographs to these folks' imaging studies both before and after surgery, and what they found was a direct correlation between upper trapezius muscles that were thick, overdeveloped, super tight, and tender to the touch, and a cervical kyphosis, which is a reverse curve in the neck, which is directly associated with a severe forward head position. Now, the correlation was so strong in this study that these researchers proposed that upper trapezius muscles that were in this state could actually be used by clinicians as a reliable predictor of a reverse curve in the neck. And they termed this cervical kyphosis trapezius sign. And the conclusion from this study was that resolving cervical kyphosis trapezius sign was associated with a high rate of pain relief. The third place to look for clues about a possible structural problem in the neck is the most obvious of the bunch, and that's the formation of a bump here at the base of the neck or excessive rounding in the upper back that looks like that. That's called a hyperkyphosis, and recently people have taken to calling this neck hump, which I don't have a problem with, except that some of these people are putting forward the idea that the body lays down fat in this region to quote-unquote protect the spine in response to that forward head shift. Now, this is complete nonsense. There's no research anywhere to suggest that that happens, and under normal physiological circumstances, the body lays down fat in a fairly even distribution throughout your body. If the body starts laying down concentrated fat in one region here that leads to the formation of a buffalo hump, this is usually related to something called Cushing's syndrome, which is a completely different issue that has nothing to do with your posture. But for the vast majority of people that have a bump forming here at the base of their neck or excessive rounding in their upper back, the explanation is very simple. Remember, the head becomes heavier the further it shifts forward. This means that the body's center of gravity is being altered, and the brain literally feels like you're going to fall on your face. When this goes on for a long enough period of time, the body will intelligently begin shifting the middle back backward to compensate for the head being shifted forward. It's an attempt to bring the center of gravity backward to make you feel safe and secure and help ensure that you don't fall on your face. The number 4 indicator is something that almost nobody looks at, despite the fact that it's right in front of our faces. So what you're going to do here is have somebody take a picture of you directly from the side, hopefully while you're not paying attention. And then you're going to take that photo and draw a vertical line from right here above your upper lip straight down towards your chin. And what you want to see when analyzing that photo is that the line drops straight downward from your maxilla here and comes into contact with, or is in very close proximity to, the point on your chin. What we know from biomechanical research is that head position and jaw position are directly related to one another, and that these two structures tend to counterbalance one another. So when the head moves out in front of the gravity line, the jaw tends to retract and jam up into those condyles, which is one of the reasons that you see a much higher incidence of temporomandibular joint dysfunction in people with a forward head position. And whenever the head retracts towards the gravity line, the bottom jaw tends to shoot out in front of us into that underbite position. So if when looking at your photo, you notice that your upper jaw sticks out way in front of your lower jaw, and you've got that classic overbite position, that could be an indication that you've lost some of the normal curve in your neck. The good news is that the relationship between these two structures is very fluid. In fact, one study demonstrated that people could gain as much as 8 millimeters of forward movement in their lower jaw after just one session of therapy to correct forward head posture. And the 5th and final clue that could be pointing to a structural problem in your neck is the presence of symptoms. And what I'm talking about here specifically is neck stiffness, muscle spasm, neck pain, shoulder pain, upper back pain, jaw pain, face pain, and headaches and migraines. And it's hard for me to believe that this is controversial in any way, but there's a handful of very vocal people out there who like to deny the relationship between posture and pain, but thankfully there's a bunch of scientific data on this subject that can help to set the record straight. This systematic review and meta-analysis from 2019 examined the relationship between forward head posture and neck pain. The researchers here looked at a total of 15 cross-sectional studies, and after poring over all of this data, they concluded that forward head posture is significantly correlated with measures of neck pain in both adults and older adults. 1 year later, this systematic review and meta-analysis was published in the journal Pain Medicine, and these researchers looked at the relationship between chronic headaches and forward head posture. Now, overall, there were 12 different studies that were selected for this qualitative analysis, and the conclusion after going through all these studies was that there is moderate to strong evidence that patients with chronic headaches have greater forward head position than people who don't have any symptoms, and that there is moderate evidence that people with chronic headaches have greater forward head posture than those who only suffer with headaches occasionally. If you found yourself going through this video and checking the boxes for some of the structural issues that we went over, you've got limited range of motion in your neck, and on top of that, you've got some of the symptoms that we just spoke about, well, I've got a couple of videos that can show you how to put the normal curve back into your neck and get rid of forward head posture once and for all, and I'll link to those here and here. I hope you check them out. Beyond that, I just want to thank you so much for watching. Make sure to hit that thumbs up button and the subscribe button before you head out of here, and I'll see you next time.